Well, in terms of the annals of public health in the Caribbean, and in terms of our development story in the Caribbean, this week has been one of the most eventful week. And in terms of history, it will be recorded as a week in which the Caribbean made huge advances in terms of improving public health and therefore improving the welfare, the economic and social welfare of our people in our own continuing Caribbean developmental story. This week we were able to lead the advocacy and lead the solidarity in putting together the fight against the NCDs at the level of the United Nations. The Caribbean played a significant leadership role in having this opportunity of a global treaty kind of in how we respond to the NCDs. In addition, we launched this week the Caribbean Public Health Agency. In the continuing story of how we deal with public health, a small region having been one of the leading regions in getting rid of measles, polio, smallpox, we have now taken a giant step forward in accelerating public health progress by establishing the Caribbean Public Health Agency. There are larger regions than us. There are regions with even worse problems than us. There are regions that are richer than us that have not been able to put together a public health agency. The US took decades to establish the CDC. The South Americans took a long time before they had a public health agency. The Europeans took a long time. The Canadians took a long time. We were able from the time of conception to realizing the dream of a public health agency to do so in a 3-year period. We were supported by the Pan American Health Organization, and we were supported by partners such as the US CDC, the Canadian Public Health Agency, the UK government, and so to do it. What does it mean to the Caribbean? It means that we will be able, as a region, to take collective action against those things that hugely impact in terms of our health and development. For example, we can work together to respond to disasters, and in terms of climate change and the problems that are occurring right now, it means that we could take both adaptive and mitigating actions collectively in the face of climate change and disasters. It means that we could take collective action, developing surveillance and information system, developing common and standardized treatment guidelines, being able to collectively access medicines and commodities as we respond to the NCDs and to other public health challenges such as HIV, such as malaria, such as TB. Dengue is now a huge problem in the region. The Caribbean Public Health Agency will enable countries to better respond to these challenges. The Caucus of Ministers of Health really establish the public health agenda, the regional public health agenda. It is the place where we put on the agenda public health issues that confront us as nations in the Caribbean. So for example, the Caucus of Ministers of Health this year in 2011, has established that vector control must be a priority public health issue. And so we are going to be reporting on vector control measures in our region on an annual basis. We recognize that so far vector control, when practiced in our region, have been in response to malaria. But we also recognize that vector-borne diseases such as dengue are important causes of morbidity and increasingly mortality in our region. But we recognize that there are also threats of vector-borne diseases such as West Nile. And we understand very well that with the increasing manifestation of climate change impacts, that vector control must be a imperative in our region. And so we have placed that on a priority agenda. We have placed, in addition, prevention of violence. And we are particularly interested in violence relating to homicide, violence that are linked to the increasing drug use in our region and the drug trade. We recognize, importantly, the place of domestic violence and sexual abuse. And so we have determined that these will be placed on the caucus agenda on a recurring basis for us to be reporting. I'm not talking about the ones we already have on the agenda, HIV, for example, TB. I'm not talking about the NCDs, since we know that's on the agenda. But these are ones that we rarely talk about, but we recognize them as public health challenges. In the case of violence, it has been dealt with in our region as a security issue. And many people argue that health should not poke its nose into things that don't concern them. But our argument as ministers of health, the caucus of ministers of health argues that we have a legitimate place on the table, that violence is a public health issue. It leads to mortality, it leads to morbidity. The caucus of ministers of health have also honed in on certain of the risk factors like tobacco. Most of the countries now have agreed to regional tobacco standards in accordance with the FCTC. But we have failed to concretize these actions. For example, we have put together labels for packaging of tobacco. And even though we all agree on it, our regional authority have not put it in place. So the Caribbean standard is something we agree on, but we haven't formalized it. And so actions were taken this week to ensure that countries on an individual basis implement that common standard that we have agreed on. So there are a number of things that we are pursuing. We have also added road safety as a public health issue. And importantly this year, we have agreed to expand our immunization program so that the PCV vaccine, the pneumococcus vaccine, covalent vaccine, become part of a routine immunization program. We have also agreed that the HPV vaccine should become part of our routine immunization program. So that this has been a caucus that has been filled with decision making. We have moved from where the caucus has been largely a talk shop to where we have made decisions on concrete actions to be taken. So we are not willing just to take action and that will lead to improvement in the lives of our people. We believe that we can provide leadership on a regional and global basis. And we demonstrated that with our leadership in NCDs. We want to do the same when it comes to things like violence, when it comes to things like vector control, when it comes to things like the immunization programs, and so on. We have led in the past, we will lead in the future. This caucus has taken a position that we will not wait to see what happened to us. We will in fact take action that will shape the future in a direction that we want. And finally, I think we agreed to a proposal I made in 2008 when I served as president of the World Health Assembly, that we in our region should pursue the program we call 75 by 25. And that proposal is that we should work to ensure that every country in the Americas, including Haiti, have a life expectancy of 75 by 2025. And that in pursuing this goal, we will pursue a larger global goal, which is 70 by 25, that every country in the globe should have a life expectancy of 70 by 2025. For that, we have to make sure that we cause interruption of preventable deaths from NCDs, so people should not die before the age 65 from an NCD. And therefore, we join in the UN goal of 25 by 25, which is reduction of NCD-related deaths by 25% for people 65 years and younger. We need to avoid all preventable deaths due to maternal mortality and under 5 mortality. If we can do these things, I believe not only can we achieve the 25 by 25, but for our region, we could achieve the 75 by 25. And by leading the globe, we could also achieve the goal of 70 by 25. And that would be a wonderful achievement if we could just have in every country on earth people living long, disability-free and productive lives. There are different ways of sharing information. And of course, when we talk about information sharing, talking about many different things. But I want to restrict this comment to the fact that we did a good thing. We dreamt for decades about a Caribbean public health agency. Public health practitioners long before me dreamt of this. We took that dream and we conceptualized it. And over the last several years, we took this concept and transformed it into a real entity. So there is now a physical thing called the Caribbean Public Health Agency. Too many times we do these things without documenting the steps we have taken, without keeping proper records and so on. So there is a level of, and this is an appeal to everyone, that as we do these things, we should be documenting every meeting, whether it's a small meeting or a big meeting, should have records, because people can go back to these records and learn from them. The problem also is that we not only keep records, but when we do keep records, it's archived in such a way that no one have access to it. And then over time, people forget and don't even know where to find them. One of the things we have done is establish a website. And that website is where we archive our records. So it's now there permanently. And so even as we are doing this, people can access information on how we are going about this and doing it. One of the great things about this era that we live in is that we do have technology. We have not utilized technology enough. And one of the things CARFO is trying to do, and we in PAHO are trying to do, is that we are making use of the technology so there is real-time information. And I would hope that we use it much more. So that's one of the things. The second thing we are doing is that on a monthly basis, we have published a bulletin. During the whole period of transforming a dream into a concept and a concept into a real entity, we have published a monthly journal for people to follow the progress we have made. And so I think this is one way of information sharing. impressive thing about CARFA is that we placed ourselves on the agenda of virtually every important organization and global and regional meeting, so that every step of the way, the progress we have made have been documented to meetings. And we have ensured that within the region, the University of the West Indies, St. George's, University of Guyana, that we ensured that they have it in their public health programs, and so that there's general knowledge of the Caribbean Public Health Agency. And so what you would see with the Caribbean Public Health Agency is that whereas most new organizations start from scratch, from the day they are established, to make people aware of their existence, the Caribbean Public Health Agency was a known agency even before it was a legal entity. So that everybody in the last couple of years have been talking, all the development agencies like the IDB, the World Bank, the Global Fund, everybody's been talking about the Caribbean Public Health Agency, and they are talking about it as if we existed. We didn't exist. We were just forming it. And now that it is fully established, it is in the psyche of all the important donors, all the important technical agencies. We have only this week become a legal entity with a legal board. And yet we have already held 2 resource mobilization or partners meeting. So by the time we finish 1 year next year of real existence, we would have held our 3rd partners meeting. So that there are different ways that one could disseminate information and make people know. We have done a good social marketing program for CARFA, and no one therefore should be surprised that one of the department of CARFA is a social marketing department. This has been done for the people of the Caribbean, and if the people don't know of it, then it doesn't seem like it can serve the people. It's been done for the people of the Caribbean, so therefore it shouldn't be a paper organization. It should be an organization whose actions are felt within people's homes, in their community, in their countries. And so as the first chair of the board of CARFA, my goal is that not only must people know that there is an entity called CARFA, they must feel it. So the next time they go to a hospital and you have quality service where doctors and practitioners are following certain guidelines, they must know it's because CARFA is promoting these actions. And next time we talk about the fact that we have avoided or averted deaths due to dengue because of things that CARFA has promoted, they must be able to say, yes, our lives are better because we have this entity called the Caribbean Public Health Agency. And so my goal is to make sure that this is not just another organization that we spend money on and people wonder what it's doing. They must be able, the ordinary people must be able to say that it has made a difference in my life. And so we need to share information. And I believe that we are unique in this era compared to public health practitioners of the past because we have unlimited technology to promote our work and to spread information among stakeholders and the people that we serve. The Directing Council is always a time that I look forward to because we all have our national priorities, and we look forward to the Pan American Health Organization to help us. We look forward to South-South cooperation, and the Directing Council provide a unique opportunity for us to concretize these South-South collaboration. For example, the International Health Regulation, which is a very important important tool that we have. This region is still weak in terms of our implementation of the IHR. And yet this region has some of the best examples of countries that have been able to implement the IHR. So it's kind of a dichotomy, it's kind of a conflict here, that you have some of the best countries and you have some of the countries that are most lagging in the same region. And so instead of us looking outward, we should be looking inward. And so linking the countries together to help each other. And my hope is that because of the actions that this directing council will take, that in fact we can look forward in the next 5 years to be the region in the world where the IHR is being implemented fully and leading the rest of the world. It is this directing council that I'm looking forward to place firmly, we have flirted, we have talked about it, road safety. Because mortality and morbidity due to vehicular accident has emerged globally as a big public health problem. But our actions relating to vehicular accident and road safety globally is not consistent with the size of the problem. And even though we have talked about it at the World Health Assembly, even though we have talked about it here at PAHO and in the region, we have not really solidified vehicular accident and road safety as a very significant public health issue. The 51st Directing Council hopefully will change that trajectory. I'm hoping that in terms of immunization, immunization has been the most significant cause of the reduced infant and child mortality. And I'm looking forward to see us expanding that program. This region has no excuse. That in 5 years' time, we must look to the world and say, every child in our region, every child of the America is a child protected by these disease-preventable vaccines. And I believe that it is immoral for us not to promote universal coverage for our children. I want to be a minister of health or a citizen of the Americas to look out there and say, each of my child in the America is a child that is protected by these wonderful vaccines. I want to be able to see that we solidify at this 51st Directing Council those actions we have agreed to at the United Nations high-level meeting on NCDs. I want to make sure that this is a region that could honestly say we have taken all action, because TB should not lead to death of any citizen. Malaria should not lead to death of any citizen. Dengue should not lead to the death of any citizen. We can stop West Nile. We can stop yellow fever. We need a good vector control program, and I would hope that we see these things happening because of actions we take at the 51st Directing Council. And it is time that we put a halt to preventable deaths from maternal causes, and there should be no death that is preventable among our children under 5 years old. This is a directing council that should shape the next decade and really shape this 21st century. We must be the region, the Americas must be the region that has the longest life expectancy in the world, that has a life expectancy with little disability affected years, so a disability-free life, and a productive life. I believe that our 75 by 25 goal should be one that we achieve easily and therefore lead the world in this holy grail of people living long, we can do it. We therefore should shape the world. And the 51st Directing Council, I look forward to as being something that people will talk about as one that shaped the future of our region and the world.